Good timing. I'm good. Thank you for asking. Doing really well today. In the middle of packing and moving, but it's sunny and we've had the tunes going. We've got yummy food, so I'm feeling pretty good. Hey, Jessica. Oh, I'm so happy to have you here.
Hi,
Oh, wow.
this is my
Welcome.
first
I
Instagram
usually
Live.
am on your end of things. I don't usually interview, so it's a first for us both. We can hold each other's hands.
Hey, cool.
Sweet. So before I ask you to give us a bit of information on yourself, I'd love to just share why I reached out to you. I found your account maybe like 6 months ago or less, and I fell in love with you straight away. I love your message. I love the way you share. I love your authenticity. I love the work you're doing. It's very much in alignment with the work that I'm doing. Very passionate about exploring female pleasure and understanding it better and educating others with a true understanding of what female pleasure is and what's possible. Yeah, and I love your commitment and your dedication and everything that you stand for. So I'm really, really happy that you agreed to come and join. Yeah, my pleasure. So I'd love to hear
Thanks for
from
having me.
you a little bit about what it is you do, and I'm sure the audience would love to hear as well, everyone that's on here live.
Um, well, my main focus has been getting more detailed clitoral anatomy disseminated in medical literature and taught to surgeons who are
Amazing.
considered qualified to operate on vulvas. And basically, I had a bad outcome from a labiaplasty. And so my whole mission fundamentally is just to stop what happened to me from happening to other people. And however I can do that, that's what I'm doing. And so one way to stop it is to make sure that surgeons who are doing these procedures are better educated. Another way is to try and educate women about their anatomy and let them know that they don't need surgery to begin with. However, I feel like there are other accounts who do that quite well, like the Vulva Gallery. And despite accounts like hers, and despite all of the efforts to educate women, female genital
Right.
cosmetic surgery has been increasing exponentially. You know, over the course of the
Right.
16 years since I had mine, it's just gotten more and more common. So I guess for me, it's about I guess yesterday I made a post where I said, no one spoke up about how my surgeon wasn't trained to do a labiaplasty, didn't know the anatomy. No one spoke up. And after I was harmed, it sort of felt like, the fact that there are no training standards for female genital cosmetic surgery and the fact that these surgeons aren't taught adequate anatomy sort of made me feel
Mm-hmm.
worthless. Like people didn't think that I was worth protecting. And so by trying to address these gaps in training, I'm sort of trying to affirm that like I was worth protecting and that women today are worth protecting. And it's not just in female genital cosmetic surgery. It might be, for women who need biopsies or who need repairs after, childbirth or sexual assault or
Mm-hmm.
anything that could lead to an injury of the vulva, you know.
It's
So
really,
that's
really powerful.
why I do what I do.
Thank you so much for sharing that. Yeah. So would you be able to share like what are some of the common, I guess, things that can happen in surgery to harm people who are getting surgery?
So it's really hard to say
I,
what's common, and sometimes I feel very alone because I
right.
don't know that what is necessarily common. What me is I had a clitoral hood reduction done without my consent. And I know that that's happened to a
Right.
number of others who have reached out to me, but I don't know if it's common. And, what happened to me is the dorsal nerves of my clitoris were injured in the clitoral hood reduction. And again, I don't know how common that is. There's no record of this happening in medical literature. Like when we published our study, we tried to make the claim that this happens, but they wouldn't let, they only let us say like this can theoretically happen, right? So I really don't know. And I know that, you know, I suspect that it happens more than people think because, you know, I was told that it couldn't happen. And I found, you know, there's like been another woman on Real Self who said she lost clitoral sensation, and you know, doctors responded by saying that that wasn't possible. So and that's what's going on online. So that's what's going on online. It's going on in doctors' offices. And most people in that situation aren't going to go dig into medical literature, going to go talk to their plastic surgeon fathers until they figure it out, right? So I had more resources, I think, than most people do. Yeah, you know what? Honestly, what happened to me probably is not very common, but it should never happen, right? You know, it's basically like preventable female genital mutilation happening in the U.S. that patients are told are safe. You were told there was no risk because of my sexual function, and then, well, that's what I read. That I read the peer-reviewed medical literature on labiaplasty at the time, and it said that there were no risks to sexual function and no serious complications. And my surgeon simply said, you talk to your dad about this, right? And you know that all surgery carries risks, right? And then my consent form was a fill-in-the-blank form that just said all surgery carries risks. So that's, and also, you know, I trusted like this website called labiaplastysurgeon.com that said the labia minora did not play a role in sexual function. So basically, I was very misinformed going into my procedure. I never would have consented if I thought there was any risk to my sexual function. Another thing that I do know is common, according to experts I've talked to, is women will have their labia minora get completely amputated by accident, right? So, you know, that also happened to me. And I know that is much more than clitoral nerve injuries. Like when I first reached out to experts in labiaplasty, well, when I first reached out to one who has done repairs, he said, I see this all the time. Most doctors don't know what they're doing. Yeah. And, you know, this happens because there are no training standards for labiaplasty. What most people don't understand is it's not like getting a nose job or a boob job, right? Because neither OBGYNs nor plastic surgeons are typically trained in residency. I was explaining this earlier today, like UT Southwestern it's been ranked the best plastic surgery residency program in the country. In last year's graduating class, only one of the residents had done labiaplasty, and he'd done one. And that's it. Yet all of the residents are now board certified plastic surgeons considered qualified to do labiaplasties.
Right.
And any other genital cosmetic surgeries.
No, it's great. This is great. This is
I'm just
such invaluable information. It's got to get out there. I mean, my biggest one, this is one of my biggest passions as well, and I'm sure a lot of the people that are watching want to know all of this, especially if they've been thinking about any kind of surgery or if they've had some kind of surgery that hasn't gone amazingly. I mean, yeah, I'm sure you're not alone.
Yeah, the other thing is I just want there to be more of an anatomical basis to female sexual dysfunction. Like if you look at literature for male sexual dysfunction, they go over the anatomy and physiology in detail.
Right.
Even on they have a whole page on how the penis works. Yet, like that is there's never anything on like how the clitoris works or how the vulva works. Like, it's just not approached the same way, and it's really crazy. So that's something that I want to change. That's why it's so cool how Stephanie Grubel, I don't know if you've seen her page. Her page is Vielma.at. She made illustrations of clitoral erection. I'm actually not sure if that's what you'd call it, but basically it's
Mm-hmm.
an illustration of what it looks like when the clitoris engorges with arousal. And that's really cool because
Right.
you always see that for the penis, but you never see it for the clitoris. I shared that on my page, and I said I hope to see this in medical literature, and I hope to see female anatomy approached the same way, or vulvar anatomy approached the same way as
and so do
anatomy.
you have, because I know in Australia we have a law that says that, the way that's been interpreted is that we aren't allowed to show inner labia in soft porn, that it needs to be digitally removed. And so it's not so easy for people to come by inner labia the way that it would normally look for many people. Is that similar in the States? Do you know? Or right.
I don't think
Yeah.
there's a law. I have heard that law before. However, there was one study of Playboy centerfolds that showed that the labia minora were not typically shown, and the vulva was often obstructed. But so I wrote this paper a long time ago that I never finished, and I went over this. And my argument is that that's not about what's considered unattractive. It's just about limiting explicitness, because it's soft for porn. And so it's like, like showing the labia minora is just racy, So I think that there has been this stigmatization of labia minora, and it's not because they're less sexy or anything like that. It's just because people are uncomfortable with sex. It's just, and labia shaming actually started with the stigmatization of female sexuality in general. And it was because in the 19th century, doctors thought that large labia minora meant that a woman had excess sexual desire, and that was considered a bad. So, so this all started with slut shaming. Like, they would amputate the labia minora and sometimes the clitoris in order to stop women from masturbating. I mean, it's terrible, and that's carried over into what we're doing now. Like, in modern plastic surgery, and at least one major modern plastic surgery textbook called Janus Essentials of Plastic Surgery, they say that protruding labia minora are caused by masturbation and sexual activity. And that chapter was written by a female plastic surgeon.
I remember holding like yoni viewing circles where we would sit in circle and show each other our yoni. And I remember like some sisters being like, I don't know if my vulva was like this before I had a baby, or if like it all, like my inner labia was stretched. And I'm like, look at around you, like most of the other women have inner labia like you. And so it was this kind of like disconnect from what was normal, but then also so much dysmorphia going on of like what was actually present and what was happening.
Yeah, so doctors, I hate to shame doctors because it's not all doctors, but there are doctors who, and maybe it's not intentional, but they exploit these insecurities. There is no evidence that the labia minora gets stretched out after pregnancy. I mean, maybe it does happen. It seems like something that could happen, but there has been, so like there have been several normative studies of labia minora size. And they have looked at the correlation between labia minora size and parody, like whether someone has had a baby.
Yeah,
and
no correlation
has ever been established.
Of vulva up to this date, and I've never seen. There's no noticeable difference between people who have vulvas who have had children and haven't. It just depends on their particular anatomy type.
Yeah, so sometimes this will lead teenagers to believe they look old and stretched out and used up. And it's just like, no, like literally nothing to do with how many partners you've had or whether you've had a baby or age, at least not according to any evidence, except actually with age. In one study, they did find an inverse correlation. So they found that women's labia minora were getting smaller.
Fascinating. What I also find really fascinating is the argument that like and I'm not against anyone doing any kind of body modification, like if they're feeling it from an empowered place and they want to make that decision, it's going to make them feel better. But when it's coming from this disempowered place of like, well, they're too big and they're uncomfortable, and then I think of like people who have penises and testes like hanging out and around and all over the place, and that they're not getting cut off for being sort of uncomfortable, which I find is really interesting. How about you? Have you had that sort of that conversation with people? Right.
So my father is a plastic surgeon, and
Right.
I grew up around cosmetic surgery being very normalized. Mm-hmm. And I was not afraid of surgery. And so, you know, so what happened was when I was 17, I started Googling, like, where is my clitoris, you know, and I ended up on Wikipedia, and then I ended up searching vulva and searching labia minora. When I searched labia minora, before and after pictures of labiaplasty came up, and that's when I was exposed to all these stigmatizing claims and false claims, like that labia minora are considered unfeminine and embarrassing. And my argument is, you know, misinformed consent is not consent. So my consent was based on believing claims like large labia minora were caused by excess androgens, which are male hormones. That made me feel like I really was not feminine. I had an embarrassing problem, and it's not true. And false claims like they're caused by aging or masturbation. Like, so I was 17. I felt like I had something to be ashamed of, and I didn't. And so I had surgery based on misinformation. These days, I'm against cosmetic surgery, even though I love my dad. It's very complicated for me because I also had a breast augmentation when I was 19. I don't talk about that much because I hate admitting that I'm too vain to get my implants out. But I regret getting them, and I will talk anyone out of it. And you know, it's a very complicated issue for me because my attitude is no matter what, there are always risks. And I know that I do not take the risks seriously, and I do not fully understand the risks.
I know I've had so many experiences with sisters who have had labiaplasty, and they've felt shame afterwards as well. They've felt shame about like whether or not the scar was, you know, visible, or their partners could feel their scar, or they'd feel shame that they didn't give themselves the time to fall in love with their body. Because, you know, in our teens, it's a journey. It's a journey of self-love, especially in this sort of the society we're brought up in to feel inadequate. It is a journey to find that self-love. And so it's almost like they feel like they've robbed themselves of the chance to accept their body, because there's no, you know, there's no taking back the inner labia. I mean, yeah, there's the potential for sort of a reversal of breast implants, but it's still not the same. So yeah, I feel you. Like I've not experienced many people who've had labiaplasty that have been really excited about that choice. But I have more seen on like interviews online, people that have been like, yeah, I feel confident in my sexuality now, and it worked for them. But I've definitely heard a lot of first-hand experiences of it not being what they thought it was going to be.
Yeah, I mean, I think what gets shared online is often super biased by, you know, like you have to look at who's sharing it, who's public.
Yeah.
You know, I think there are huge financial incentives 100%. To share positive stories. I don't think that anyone should feel ashamed. Like I don't feel ashamed at all for my decision to seek plasty because I was completely misled and it wasn't my fault. The only reason I do feel some shame around my breast augmentation because I am sitting here with breast implants still and I haven't gotten them out. So I feel uncomfortable talking about it because I want to say I'm against it. But you know, I actually I mean, this is off topic, but I mean, hopefully you don't mind me talking. You know, so I got breast implants when I was 19, and I got severely depressed afterwards, and I dropped out of school, and I hated myself. Like I dropped out of my second semester of college, and then, you know, eventually I ended up having them or eventually, what we did is, well, I had them like popped. Like we stuck a needle in them and they were deflated, and I just had the empty bags in my chest. And the reason we did this was to avoid me having to have 2 surgeries, and to make it so that I would have like the time to decide what I wanted to do, because I wasn't sure. Just creepy, like weird for me, you know. Like I talked to some women and they say that like the skin tightens back up, but it was like, you know, I just felt like too vain to have stretched out breasts at, you know, 20 years old. I mean, you know, and yeah, and so I did it again, and now, you know, I'm 34 and I have to figure out what I'm doing, because you know, they're old now. I have to like get them replaced or something, and it's, you know, it's a complicated issue and it's a pain. Like I don't think, like when you're 19 and you get breast implants, you don't think like, gosh, I'm gonna have to have another surgery in 10 to 15 years. It's off your radar. And now I'm so scared of surgery because my track record with surgery is so bad. So like, with my luck, I'm gonna like die next time. I'm
I've actually spoken to 2 sisters this year who
it's not funny.
This year who have had their breasts, both of their breasts removed. One had, it was because she had cancer, and the other one, there was an infection or something, and they'd both had them for so many years, and they both had them out, and they're so happy. But yeah, I guess, yeah, one of the big things is like it's ongoing surgery that people don't really think about, where I guess with the labiaplasty, it's a one-time thing and it's kind of done, right? Unless people want to keep going.
Yeah, that's always, yeah. I do not recommend labiaplasty to anyone unless they have, you know, unless it's really getting in the way of their daily life and their comfort, you know. And then in those cases, I would ask them to please DM me so I can help them with their surgeon.
Yeah.
Because,
wow,
you know, it really is like the wild, wild west.
Yeah. Yeah, and I feel like what you were saying before about informed consent with labiaplasty, like if someone knows the risks, they know that their inner labia is normal as it is. If they know like all of these things and they're like, yeah, but I still want to do it, you know, only then making a decision. But coming from a place of not knowing the risks involved, not knowing that you're normal, not knowing that, you know, there's a potential for pleasure to be inhibited, then that's not consensual, and it's essentially taking advantage of young and other women.
Yeah. I mean, I think most of the time, you know, it's not worth it, because like I really think that the beauty standard that they should be hidden is totally fake. You know, I don't like men who are like sexually experienced and like understand women's anatomy, like they don't ever actually seem to have issues with,
I remember
like,
my partner
that
telling me once, he was like, when he was I think 18 or so, he had a partner who had like more plush inner labia, and he was so shocked because he was so conditioned to porn and just like thinking that there was like, it's just like a line and a hole and that was it. And so he was like, first of all, taken aback because of his conditioning, and then he was like so turned on by it because it was like this new erotic, exotic thing that he didn't know existed. And unfortunately, I have seen some really shitty fucking comments and things online about inner labia when doing polls, or other people doing polls, but the general majority like love it so much. And I think another really important thing to consider is like, you know, why is big inner labia bad, while, you know, big breasts are good and big penises are good, but it's like small waist, big this, small that. Like who is, you know, beauty's in the eye of the beholder, and every culture is so different. I know in some parts of Africa they actually pull on their inner labia to make them longer because that's considered more beautiful, which has its own problems in and of itself, because it's not just letting us be who we are in our natural form as beautiful expressions of life. So yeah, I think like doing the journey of like exploring our own inner labia and understanding it and becoming exposed is really important. And also, like, I know a lot of females that I've talked to, or people with vulvas that I've talked to, have had a lot of the harshest comments from their mothers because of their mother's own wounding around their vulva and their like lack of acceptance and whatever. Like I've talked to many sisters who have said like their mum when they were young pointed out their inner labia and said it was ugly and gross and big and should be hidden and don't let anyone see it. And so there's some of this wounding is coming from the feminine itself. And I think it's like really important for us to be mindful of these comments, especially when you're in this position of power as like a mother, the first guru. You know, our children listen to us and they absorb everything that we say. So it's, yeah, I think it's really important to be mindful that it's not just porn and it's not just men, but there's also like a lot of it coming from within and from the feminine.
Yeah, I think I think a lot of it just comes from a lack of education and how, you know, girls aren't told
Right.
that their labia minor will change with puberty. It's just about, I think it comes also a lot from us calling vulvas vagina because we conceptualize
Right.
female genitals as internal and as a whole. And so that causes stigmatization around anything external, especially if it shows. And we end up with this dichotomous view of male and female genitals as male being external and female being internal. And that's not how it is. Like, women have genitals and that's okay. And I think also female external genitals get stigmatized because female sexuality gets stigmatized. And, you know, it's very much a part of the pattern of suppression of female sexuality. It's about, you know, ideas that like women shouldn't be sexual, like they're emotional and reproductive, but not sexual. And it kind of goes with the same reasons behind female genital mutilation, and in my opinion.
Totally.
Like,
and it's almost like, you know,
all
the
these
whole
patterns
submissive role of like being like a woman. It's like, yeah, you're seen, you're not heard, but then also like, you know, if you look at the genitalia of a female who's been completely shaved and has no inner labia, she looks just like a little girl. And not that there's anything wrong with that, you know, that happens naturally for a lot of people, but the fact that we're expecting all females or all vulva havers to look this way, I think is, yeah, very much a part of oppressing females or women in general, so that we're not seen, we're seen but we're not heard. And I know my teacher says that the vulva is like the face of Lilith. It's like the archetypal of energy of the wild woman, and we're supposed to be like fuck, like, do I want to go here? Do I want to go into the mystery of the feminine? Like, am I ready enough? Am I ready to go inside, or you know, do I have to do my own journey, because it is a sacred place to go? And if we're just all prettied up and tidied up and not threatening, then it's like, yeah, well, we can do whatever we want to exist as this sweet, submissive, prepubescent looking genitalia, which, yeah, I think is huge. It says, and I think also the terminology like inner labia, outer labia, I love using, because minora is like suggesting it's the smaller inner labia, that it has to be small, and majora is like saying that the outer labia should be larger. So it's like, even in our language, you know, scientifically speaking, we're saying that the inner labia is small and we're saying the outer labia is large. And it's, I think it's such, yeah, it's so in our conditioning that we don't even really realize that it's happening.
Yeah, the minora and majora thing doesn't bother me so much, because I think in terms of volume, I'm not sure. I think the labia and majora are typically always bigger in terms of volume, even if they don't stick out. But I definitely see what you mean. I do think, yeah, by denying female external genitals, we're framing female sexuality as passive and receptive. One example of this theme was on WebMD recently. In the article, so they have an article on penile anatomy, and then they have an article on the vulva and the vagina, but they don't really cover the vulva. And on the penile anatomy page, they talk about how the penis engorges, fills with blood. They talk about nerves. They talk, you know,
Right.
they talk about erections. It's detailed. And then on the vagina and vulva page,
Whoa.
all they say is the vagina receives the penis.
Right. Totally
That's
disregarding
it.
homosexuality and
Yeah,
all the pleasure. Yeah, right.
yeah. But it completely disregards the fact that
Yeah.
women have like a similar process of engorgement going on.
Pardon. Yeah.
Like we also basically get erections. I mean,
Yeah.
I'm still not sure if it
Yeah.
makes sense to call them erections, but you know, like our vulvas engorge. And one thing that happens is the labia minora engorge, and they stick out. So one thing sort of funny is how, you know, an aroused vulva has labia minora that stick out more, and that's considered
That's really
like
interesting,
that's
isn't it?
super
Because it's
backwards.
like, I know, yeah, when we're aroused, like our lips are redder and our cheeks are redder, and it's like that's accepted, like that's acceptable to have like that aspect of arousal. But then the aspect of arousal where yeah, we're kind of like not competing with you know, the genitalia of like the penis and whatever, but it's almost like we can't be the ones that are, yeah, penetrative and external and maybe even dominating or um yeah, being seen like in that light. That's really, really good point. Yeah.
Yeah, there was this one astrologist who sent me a
Mm-hmm.
paper one time on the psychomorphology of the clitoris, and she said, "This is why you're having so much difficulty getting this anatomy disseminated." And the article was a little bit complicated for me. Anyone can look it up or like contact me if you want a copy. But basically, it talked about how the clitoris has been associated with lesbianism and, you know, uncontrolled female sexuality and
Right.
nymphomania and all of this taboo surrounding it. And though they didn't talk about labia minora in the
Right.
article, I think there are the same themes. Like actually in 19th century medical literature, like you can find doctors saying, here
No.
is a vulva of a lesbian, or here, like this patient says she doesn't masturbate, but I know she
Whoa,
does because
okay.
her
I
labia
didn't
minora are
know that
large.
at all. Fascinating. Wow, it's no wonder, yeah, they're being treated as if there's some kind of like demonized object that no one should ever see, because that's what it was. Wow. Fascinating.
Yeah, I mean that's, but I
Big
think the
time. And so,
history
yeah,
sort of has
instead
carried
of,
over into the
and it's almost
present.
like instead of it's done so perfectly designed for capitalism, because it's like people with vulvas are self-electedly going in and getting the surgery done and paying for it, not even realizing that it's completely irrational and unnecessary. And yeah, wow, fascinating.
So as for the reference, I can't
Right.
remember. It's Dickinson. I think he was an anatomist, or I can't remember if he was an anatomist or an OBGYN, but he studied a lot of vulvas. He actually recorded the morphology of like 1,000 vulvas and concluded that
Oh
over a third of
wow,
them had deformities.
it's so harmful.
I think
Right.
so. I
Doing that.
think he must have been a gynecologist actually, if he was with that. If
Wow.
he was
Yeah.
vulvas, I forget the details. But it's funny. So some things that are interesting, like if you dig into old medical literature, you can see how, like, for one, they actually covered clitoral anatomy better. And like I found one old textbook from the 19th century that said the dorsal nerves in the clitoris were larger than in the dorsal nerve than in the penis. And so like here I am in 2020, like fighting for people to include these nerves, and they were actually recognized as larger and back then. And you know, I found like a dissection guide from like I think the earliest 20th century, where they said students should dissect the nerves in the clitoris, and they should be able to dissect them to the glands. And I'm like, yeah, that's what we should be doing now. But it's like
Whoa,
a
wow.
struggle to get them to do it now. So that's why I get frustrated when people act like this is new anatomy.
Yep.
It's not. It's just, it's been a choice whether people take the effort to teach it and to learn it and to include it in books. It's not a matter of like having not discovered science yet. You know, like sometimes people are like, well, Jessica, science evolves and you have to be patient. I'm like, no, that's not what's going on here.
It's been a long time.
And so that's like one claim that people always make is that the full anatomy of the clitoris wasn't discovered until 1990. And they actually believe that the bulbs and crura of the clitoris were not discovered until 1998, which doesn't make any sense. You can walk over to a medical library and you can see them shown in major anatomy textbooks. and meanwhile, Oconnell, the urologist who published this study in 1998 that supposedly covered the full anatomy for the first time, she didn't even discuss she didn't discuss any detail. Like, so she didn't go over the innervation or vasculature
just missed
in 1998.
Yeah.
There's a lot of misinformation.
Well, you definitely had your work cut out for you, eh?
Someone asked if anyone did this study on penises. Of course. There's tons of information on penises. Actually, so when we were doing our dissection study, so I did this dissection study with plastic surgeons, and one of the residents said, of course, there's tons and tons on penises because men love talking about their penises, you know, but they hadn't learned learned the equivalent anatomy.
And so
for the
I'd love
clitoris.
to talk a little bit about the anatomy of the clitoral complex and the dorsal nerve and the role it plays, and what can happen just in general, like with a disconnect to that nerve and sensation and pleasure, whether it be through surgery or through some kind of injury. Is there anything that you have that you could share on that? Okay.
Wait, I'm sorry. I would love to talk about the dorsal nerves and the clitoral complex and how they
and what can happen,
how
and
like
if there's
injuries can
occur. I know like the innervation of the vagina in general, internally and externally, like there's different nerves and different pathways. Just love to hear, like, I guess maybe the first three things that come to your mind about the innervation of the clitoris and the clitoral complex, and anything that you feel would be really useful for people to know, whether they've had some kind of injury or whether they want to understand that maybe they haven't felt pleasure in their glans clitoris because of whatever reason.
So I mostly just know about the external innervation, or the nerves that I dissected are in the clitoral body, and so I'm not clear on the innervation of the crura or the bulbs. I'm not sure if that's really that significant. I mean, for me, even with my injury, I mean, TMI, but the only way I can orgasm, like, I don't know if people want to know this, the only way I can orgasm is by stimulating what's still sensitive in the external part of my clitoris, so the base of the clitoral body. So one thing interesting in my study is the nerves were 3.2 millimeters in diameter at the angle of the clitoris, the part where it turns. Like, so there's the legs, or there's the bulbs, and then the crura, and then the clitoral body that kind of goes like this, or goes like this. And at the angle, the part where it turns, they were 3.2 millimeters in diameter, which is crazy. And it's possible that the resident who measured them made a mistake, but he tried to be careful. I mean, so I think maybe the nerves are just huge. And they were 2 millimeters in diameter on average, where they terminated. Now, we only dissected them all the way to the glands in 4 specimens, and I only got to dissect 1 from our main study. So, and I got it all the way to the glands, just for the record. But, you know, like sometimes I guess it just got too difficult to keep dissecting, and so we just measured, you know, how the diameter there. And I can send anyone who wants a copy of my study a copy of my study so that they can see. But it is really interesting how large the nerves are. And what's relevant about the change in diameter is it does mean, you know, there are nerve endings in the clitoral body and in the clitoral hood before you get to the glands. And so that's how I do still have some sensation. The other that's interesting is where we first measured the nerves, they were 3.6 millimeters in diameter, but then they were 3.2 by the time you get to the angle. So there, that means there's branching somewhere. Like maybe that's, I don't know where they were going. Maybe that's what goes to G-spot. I don't actually know. But that's all I can say. Like I can say where these nerves are, and they're surprisingly large. So it's crazy to me how anyone would ignore them. So like, you know, one of the most common emojis in my phone now is the clown face, because it's all just so crazy. I'm always using clown to describe all of my opinions. Because it's so crazy to me that people would be dissecting a vulva and just stop where the nerves are large. Like this one, like, so the woman that I ended up getting to publish the nerves in the clitoris in OBGYN literature for the first time is this woman, Dr. Marlene Corton. And I feel bad because I made a lot of mistakes when I reached out to her and I offended her. And, you know, people have still been getting offended by me. And this week has been a bad week because I upset a bunch of people with some posts. But, you know, what people haven't seen is, unless they've been following me for almost 3 years, is that I have improved. So I am actually less blunt, I'm less aggressive, and less in everybody's face than I used to be. Because in the old days, if people told me no or didn't agree, I'd be like, bitchy. So I definitely made some mistakes early on. When I reached out to this woman, she initially responded that she wasn't sure if there was room for the innervation of the clitoris in an OBGYN surgery textbook. And she said, those nerves are very tiny and difficult to dissect, unlike the nerves in the penis. That's not true. And she sent me a study that she had done of the branches of the pudendal nerve. So the pudendal nerve is what leads to the dorsal nerves of the clitoris. And so she dissected the dorsal nerves of the clitoris all the way up to the clitoris and then stopped. Right. So I don't know how that happens. It's like, and I've asked my dad, I'm like, we're sitting there dissecting, and I'm like, what kind of idiot just stopped? Like, why would I ever do that? And my dad's like, I think they just get awkward. Like, if you ask my dad, his perception is that people just get to the clitoris and they're like, oh shit, like we better just not. Like,
right.
Even though it's easy, like, because I'm not a surgeon. You know, I have no medical training, and this was not hard for me. So if there's like an expert in gynecologic surgery claiming that it's hard, like, can he even safe to operate on people? Like, or if, you know, so it's not really hard. It's just like psychologically uncomfortable for her. It just makes sense. But she ended up actually publishing a very good study in the American Journal of OBGYN. Though there were some mistakes in it, so I wrote a letter to the editor. And she did get 2 textbooks changed. And I definitely messed up by offending her because you know, so I have had to learn the same lesson over and over, like to be nice.
Passionate about something that's really hard for me to be mindful of people's feelings. Right.
Yeah, especially because I got hurt. So I got hurt, and I'm reading, and she's like, and I'm reading a textbook chapter that she wrote. So she actually, you know, in this one book, Williams Gynecology, which is now updated, in the old edition, you know, she didn't go over clitoral anatomy well. She didn't talk about any function of the labia minora, and I think they still don't talk about any function of the labia minora, which is another thing that
Right.
bothers me. But at this point, I try to like pick my battles and just like
Right.
I'm just like very single-minded about the clitoris right now. But before, you know, it's like they don't talk about the function of the labia minora. They describe the clitoral hood basically as formed by the labia minora under the labia minora category, which is problematic because what I try to drive home is that the clitoral hood is basically the skin of the clitoris. And so if you're operating on the clitoral hood, you're fundamentally operating on clitoral skin, and the nerves are just beneath, and that happen. But so it's hard for me when I like know that she's saying that labiaplasty is safe and effective, and she's describing techniques in a very like rudimentary way and not talking about how to avoid harm and not going surgical anatomy. And it's like, you know, so when somebody like that doesn't just do what doesn't just agree to changes right away, like it's hard. It's been hard for me. And so sometimes I end up in this like grr, like I'm fighting everyone mindset, and that, you know, and I end up making mistakes because I know I'm not really fighting everyone, and you know, like it's just really complicated. I think like people don't like to be criticized. People don't like being told what to do.
Sometimes it can be really hard when especially if like intentions are pure and then they're told that they're wrong, and it's like their ego. I found that so many times actually when I'm in Western medicine sort of scenarios, when like I feel like I'm sort of, it's a delicate ego of like, yes, like you did have 7 years of medical school, like you definitely know more than me about my body, but can I just like let you know that wasn't right? Like I have to like tippy toe around the ego in medicine, which feels really stupid. Like it doesn't, it's like, yeah, I don't want to offend anybody, but they could really fuck up if they don't listen to me. And I feel a lot of the time they don't listen because there is that ego there of like, I know everything there is to know. And I know doctors learn a lot, and I know they put in so many hours, and they're, you know, doing a lot of good things for us. But at the same time, yeah, there's, you know, the shadow side of everything. So I can imagine that's really, really tricky. And I'm so grateful that you're doing it, even if it is hard.
Yeah, I've definitely gotten better at figuring out how to, you know, kind of compliment people and then focus on the positive. Like now if I write emails asking people to change things, you know, I say, you know, I think that your textbook could be improved if, you know, this, and you know, illustrations for my study. I think that really helps too, so that people right away know what I'm talking about. One OBGYN who initially responded to me, I don't know what you're like. So back then I was writing emails and I was saying, hey, this anatomy is not in OBGYN literature. Would you be interested in doing a study to get it in an OBGYN journal? And, you know, the email was just like, this is a great opportunity, blah, blah, blah. And I sent that out to a bunch of OBGYNs, and most did not respond. And this one woman responded. She said, I don't know what you're talking about. We talk about clitorises all the time. And I remember feeling so exasperated and just like, fuck this, God damn it, you know. And so what's amazing is, so I felt like totally unable to get through to her at the time. And I can't remember if I said anything bitchy. Maybe I resisted. Maybe I just let it go. I can't remember. I don't think I responded. I think I was just like, I just remember being angry. But what's amazing is, same woman recently has reached out to me, like thanking me for my work, being extremely nice and complimentary to me. She used my illustrations in her talk at this. Yeah, and she even cited my Medium, which is really, because people can put whatever they want on Medium. It's not like a credible source. But I do write a lot of things on Medium.
Thank you so much for sharing all of that. I'm going to see if there are any questions. If anyone has any questions, pop them in the question box. Oh, there's a lot of like comments. So many great comments in here as well. I don't know if you can. I can read some out.
Can I see them, or
You can see them?
oh,
Sweet. I don't know if it doesn't look like anyone's asking any questions. For those people who've just joined. Yeah.
and plastic surgeries? I think about 90% of
Wow.
cosmetic surgery patients are women.
Yeah.
So more and more men, but it's still like 90% women. And 90%, it's
Right.
around 90% male surgeons too. So it's like, or it's, you know, it's
Right.
somewhere, it's like high 80s, low 90s for both the stats. Somewhere around there.
Right.
So that's one thing that doesn't
Yeah,
sit
it's
well
like
with me
that thing
either.
where we've given our power away to men in white coats on our health and our body and our well-being, and you know, it kind of permeates everywhere from like mild health conditions to extreme sort of situations involving surgery and yeah, irreversible surgery and yeah, cosmetic like kind of elective surgery. Me neither. Oh, I think I've got one
I'm
popped
not
in.
seeing many
Any
questions, but
ideas about how episiotomy affects women's sexuality?
oh, somebody said on their penis. Actually, I had a guy text me about some penile surgeries the other day, and the thing that was funny is he sent me some article that a plastic surgeon wrote where they were going over like some kind of like penile augmentation surgery, and then saying that they were going to discuss female genital cosmetic surgery later in order to be even-handed. And I laughed. I'm actually not sure why he sent it to me. I might have to follow up, but I laughed because like the there's so much on female genital cosmetic surgery, and hardly
Right.
anyone is ever thinking about like how to improve penises. So this is like the goal, and the plastic surgeon is like, well, let me
Right.
make sure I discuss this. I found that comical, but I don't think there's that much. I think that men are much more intuitively afraid to have cosmetics, any
Right.
kind of surgery done
Yeah, I
in their
mean, I know
penis.
something that I've experienced so many times when working with people in sexuality, like generally speaking, heterosexual women will be more likely to put up with pain and tolerate in sex and not say anything, and sort of disassociate or just like have their partner like get their pleasure through their partner experiencing pleasure, where if there's any kind of pain felt by men, they're straight away ready to say something about it, you know, they're like, ow, that hurt, or don't do that, you know, that's so easy for them to like communicate like, don't hurt me in this area, it's delicate and it needs to be respected. Whereas yeah, I found so many heterosexual women do not, they just are happy to tolerate in sex in order to either get it over and done with quicker or to not hurt their partner's ego. And so it makes sense that that's reflected in surgery, that maybe some men are thinking like, oh, I wish I had this kind of penis and I could maybe have this kind of surgery, but fuck that, like I'm keeping my dick how it is. Whereas females are like, well, I'm going to make everyone happier and my lovers love me more if I change myself. So someone just asked a question about episiotomies and how that affects sexuality. I know in my experience with the scar tissue, something that can be really helpful is just doing a lot of massage that can help like break up the scar tissue and bring blood flow, and it can be pleasurable again for some women. Have you heard of anything about episiotomies? Is that not really? Mm-hmm.
I don't
Yeah,
know much
sweet.
about it. No.
Cool.
Um,
So I think that they're all the questions.
as far as what you were saying, you know, I think that goes with the theme of women
Right.
being less assertive and more people pleasing. There is a pattern of women being more afraid
Yeah.
to speak up and stand up for themselves,
Right.
and of just trying to make everybody else happy all the time.
Yeah.
And to our own detriment. And That is social
Sweet,
conditioning that
same.
I sort of missed
I
out
mean,
on.
a lot of the time. There are still times where I'm lax with my boundaries, and some situation will bring me undone. But I've definitely was lucky enough to be taught to speak up for myself, and it's also got me in a lot of trouble. Um, but when we think about the fact that we're coming from a history of
Yeah,
not being able to have boundaries, you know, women were able in Australia, you're allowed to rape your wife until a few decades ago. It makes sense that we're just kind of starting to explore like the freedom of our body is our own and we're allowed to say no and we don't have to say why. So yeah, I guess it's like we're in this sort of this transitionary phase where we're actually learning again how to have sovereignty over our body. Just so we're at 1 minute 25 seconds. So any final things you would like to share? I'm so grateful, Jessica. Like this has been amazing. My pleasure.
thanks for having me.
Sweet.
I think that's pretty much it. I
Yeah.
think, yeah, I just want to add that, yeah, I really do wish we could, encourage women to be assertive and advocate for themselves and their needs. Like one thing I was saying earlier today, to a woman who called, a follower who called, is, men are not as selfish as they are stereotyped as being. Um, they just kind of
Right.
need to
Yeah,
be
it's not
told
going
what
to
to
hurt
do.
to use our voice if
That's my
we,
opinion.
yeah, if we just have to do it, right? And once we do it, we realize we survive and it's okay. Like, and then actually we get what we want. It's not that difficult. We can keep doing it. It's like a muscle that we just need to exercise and keep doing.